You're watching Brazos Valley This Morning on KBTX News 3.
Ahead of COVID-19, local medical professionals and first responders were concerned about overrunning their call systems. As hospitalizations locally remain low, another stat is starting to concern them: the decrease in medical calls. News 3's Kendall Hogan spoke with 2 local fire departments today who've noted a dramatic decline.
Before making their way out to a call, local EMS are prepping with gloves, masks, and face shields. But the amount of times they've responded to calls recently is decreasing.
And what we're hearing from the hospital community as well is when people are going to the hospital, they're pretty sick because they've not been, they delayed their care.
College Station Fire Chief Richard Mann says that compared to 2019, their EMS calls dropped 28% in April and 15% in May.
So even though we've got COVID going on, I know we're still having heart attacks in the community, we're still having strokes, and those kind of things, time is of the essence.
We typically on an ambulance in Bryan run on the average of about 950 calls a month. We're seeing about a 10 to 15% reduction right now in that in the last 30 to 60 days.
Bryan Fire Assistant Chief Joe Ondrasek says both during and after calls, they've added extra precautions like PPE and disinfecting.
Changing how we respond on calls, to wearing the PPE on all the calls, how we decon, when we decon, changing uniforms, washing uniforms, moving people around so that we don't have all of our folks at one fire station.
All to ensure safe care and transportation.
Those things where the skills that the paramedic brings make a true difference in the outcome of a patient, we want to be there for them.
Kendall Hogan, News 3.
Local fire departments say that for non-urgent care, it's important to also call a medical professional or see a healthcare provider if needed.